everyone. Welcome to our Physiotherapy Business Practices Standards webinar. My name is Sameera Merchant. I'm a physiotherapist and a practice advisor with the College of Physiotherapists of Ontario.
Thank you for joining us today. My name is Mary-Catherine, and I'm also a physiotherapist and a practice advisor here at the college. Members of the practice advice team get to speak with physiotherapy students across Ontario each year to discuss the concept of appropriate business practices and to provide real-life examples of how these practices are applied and upheld in physiotherapy workplaces. We discuss cases and scenarios where standards related to business practices were not properly followed and how that harmed patients. This webinar today is for those physiotherapists who have not had the chance to be a part of one of those workshops. We are going to present 5 different scenarios that include examples of improper business practices, and then summarize how to incorporate good practice principles into your daily physiotherapy practice. You don't have to be a clinic owner to need to know what your obligations are when it comes to business practices. As a physiotherapist in Ontario, you should be aware of good business practices and be following them 100% of the time. The college has a zero-tolerance approach for inappropriate business practices. The public interest depends on the integrity of the profession. Protecting the integrity of the profession demands a zero tolerance of inappropriate business practices. The professional standards that will be relied upon for guidance today include the Conflict of Interest Standard, Fees and Billing Standard, Risk Management Standard, and Supervision Standard.
Thank you, Mary-Catherine, for laying the foundation for today's presentation. Let's get started by looking at some real-life scenarios together. Case 1, too good to be true. A PT is searching for a new job, and they find a job posting which seems too good to be true. The clinic owner runs a business where a physiotherapist, PT, conducts only initial assessments virtually. The PT is encouraged to provide a very general and broad diagnosis, like improve core strengthening or improve overall flexibility. The PT assigns exercise programs to PTAs to work with all patients. The PT is expected to follow up virtually with each patient at 3-month intervals to perform reassessments and to assign more exercises to PTAs. But the clinic owner says that reassessments do not need to happen. The pay is great. What could possibly be wrong? Mary-Catherine, could you highlight the concerns raised by this scenario and share guidance for what good practice should look like?
Thanks, Sameera. This is a model where physiotherapists are used mainly for their name and registration number for billing purposes. The clinic owner is paying the physiotherapist a much higher than normal hourly salary rate. The PT conducts a broad and very general assessment, and then the care is carried out by PT assistants who are often athletic trainers or kinesiologists, and the physiotherapist is removed from the patient's care. Good practice would include whether providing an assessment in person or virtually that the physiotherapist ensures they understand and can meet their professional standards. The PT must complete a comprehensive assessment that includes collecting information about the patient's experiences, their goals, and performing objective assessments. The physiotherapist must use their clinical expertise, considering the patient's needs and evidence-informed care, to determine a physiotherapy-specific diagnosis and develop personalized treatment plans tailored to each of the patient's needs and goals. If physiotherapists are assigning any part of the care to an assistant, the physiotherapists must ensure the PTAs understand the treatment plan and are competent to deliver it. The physiotherapist must consider factors such as the patient's condition, the type of care provided, goals of treatment, and patient safety. Not every patient is appropriate for a virtual assessment or for working with an assistant. The physiotherapist should have a clinical rationale for when the reassessment needs to happen. This will vary with each patient. The physiotherapist must plan regular and timely reassessments to monitor each patient's progress, adjust their exercise programs, and address any patient concerns, injuries, and setbacks in treatment promptly. The assessments, treatments, and reassessments should be documented in the patient file. If the PTA is documenting some of the treatment, the physiotherapist must review the quality of the documentation. The physiotherapist's name and registration number are used for billing purposes, and the physiotherapist is responsible for all the care being provided. This means the physiotherapist must review billing by checking the accuracy of invoices, the amount charged, and the date, and compare it to what was documented in the patient record. They must document a record of the audit and the outcome and any steps that were taken to correct errors. Any equipment used at the clinic by patients must be maintained and regularly checked for safety. Even though the physiotherapist works remotely, they are responsible for ensuring these equipment checks are completed. If within a proposed new job, you cannot complete any of this, you may not be meeting your professional obligations. By implementing these recommendations, physiotherapists can effectively supervise PT assistants, ensure the delivery of safe and quality care, and maintain patient engagement and satisfaction in all types of care settings.
Thank you, Mary-Catherine. Let's now walk through a different scenario together. Case 2, weight loss treatment request. A patient asks the physiotherapist to develop a treatment plan to help them lose weight. The PT is unsure how to proceed. Unsure of whether this is appropriate, the PT checks the scope of practice outlined in the Physiotherapy Act to understand what is allowed and what the limits of a PT's practice are. Mary-Catherine, could you highlight why the PT considered scope of practice in this scenario and review with us what is the PT scope of practice?
Thanks, Sameera. In Ontario, the practice of physiotherapy involves the assessment of neuromuscular, musculoskeletal, and cardiorespiratory systems, the diagnosis of diseases or disorders associated with physical dysfunction, injury, or pain, and the treatment, rehabilitation, and prevention or relief of physical dysfunction, injury, or pain to develop, maintain, rehabilitate, or augment function and promote mobility. The physiotherapist in this scenario correctly understands that specific diet counseling is not within their scope. Physiotherapists cannot provide personalized diet plans or detailed nutrition advice, such as creating individualized meal plans for patients or recommending specific nutrient amounts for individuals. Instead, physiotherapists should refer the patient to trained professionals, such as dietitians. However, physiotherapists can offer general advice based on trusted sources, like the Canada Food Guide. This might include suggesting a balanced diet with a variety of foods, encouraging the consumption of fruits, vegetables, whole grains, and lean proteins, advising adequate water intake, and recommending the reduction of processed foods and sugars. Physiotherapists cannot prescribe supplements and must consider their training, knowledge, and scope, as well as the potential risks, including drug interactions, when advising patients on health-related matters related to nutrition and supplementation.
Thanks, Mary-Catherine. Let's now discuss a third scenario looking at business practices. Case 3, the upsell. The physiotherapist works at a busy private clinic known for its state-of-the-art equipment and comprehensive wellness programs. The clinic owner instructs the PTs to sell specialized equipment to patients. PTs will receive a bonus if they successfully sell a certain number of these pieces of exercise equipment. These upsells are not always clinically necessary, but are presented as beneficial for the patient's overall health and wellness. A 45-year-old office worker visits the clinic for chronic lower back pain. After a thorough assessment, the PT develops a treatment plan focusing on manual therapy, exercises, and ergonomic advice to address the patient's condition effectively. Because they read a poster about the exercise equipment in the waiting room, the patient asks if they should also get the equipment. the PT is faced with a difficult decision. They know that the standard treatment plan they developed is sufficient to address the patient's back pain, but face pressure from the employer to sell the products. Mary-Catherine, could you share with us what good practice in this scenario should look like?
Thanks, Sameera. Good practice in this situation includes the physiotherapist who decides to prioritize the patient's best interests. The physiotherapist should have an open and honest conversation with the patient, first recommending the treatment plan they developed, explaining how it addresses the patient's back pain and supports recovery. The physiotherapist may discuss the available products, but provide an honest, evidence-based assessment of how these products may or may not contribute to the patient's recovery. The physiotherapist should reassure the patient that their decision to purchase or not purchase the equipment will not impact the quality of care they receive. The physiotherapist must also share that they receive some financial compensation for each piece of equipment sold. To maintain transparency, the physiotherapist documents the discussion in the patient's chart, including the details of the treatment plan, the conversation about the additional products, and the patient's decision regarding the purchase or not. To avoid a conflict of interest, the physiotherapist must share the potential for financial compensation with the patient and note it in the patient record, and offer alternative locations where the equipment could be sourced.
Thank you, Mary-Catherine, for sharing the invaluable guidance. Let's continue to build on good practice by looking at a fourth scenario focused on billing practices. Case 4, fraud. A patient is receiving physiotherapy care and progressing well. Their care is being covered under their benefit plan provided by their employer. They have access to $500 a year for physiotherapy care. They run out of funding and ask the PT to bill under their spouse's name for their care. Mary-Catherine, how could the PT ensure good practice in this scenario?
Thanks, Sameera. Good practice includes that a physiotherapist does not ever bill physiotherapy care under another person's name, in this case, the spouse's benefits. We understand that these conversations can be uncomfortable, but it's important for the physiotherapist to address the issue directly and refer to their accountability. A conversation could go like this. I understand that you are looking for ways to extend your funding for physiotherapy care. However, it is against our ethical and professional obligations to bill services under a name other than the actual patient receiving care. Billing under someone else's name is considered fraudulent and can lead to serious consequences for both you as the patient and our physiotherapy practice. The physiotherapist should discuss alternative options available to support the patient's continued progress. These options might include developing a comprehensive home exercise plan tailored to the patient's needs, scheduling less frequent in-clinic visits supplemented by home exercises, or exploring other funding sources such as community programs or health spending accounts. Finally, the physiotherapist should ensure that all billing is accurate and reflects the services provided, maintaining integrity and accountability by using their name and registration number correctly.
Thank you, Mary-Catherine. Now let's examine our fifth and final scenario for today's presentation. Case 5, Pilates. A PT recently received Pilates training and is excited to use it in their PT practice. Jacob, a 30-year-old with a history of lower back pain, comes to the PT for physiotherapy. Eager to use their new Pilates training, they decide to start Jacob on a series of group-based Pilates exercises immediately, assuming they will help strengthen Jacob's core muscles and alleviate pain. The sessions are billed as physiotherapy. However, things are not done correctly. Without conducting a thorough assessment of Jacob's specific condition, the PT skipped the step of determining whether the treatment plan that includes Pilates is the right approach for Jacob's back pain. The PT also did not take the time to tailor the exercises to the patient's individual needs or discuss potential risks. After a few sessions, Jacob's pain worsens, and they become discouraged by the lack of improvement. In this scenario, Pilates was incorrectly applied as a treatment without first conducting a proper assessment of the patient's condition. Without this critical step, the exercises were not tailored to Jacob's specific needs, resulting in a treatment that could not be considered physiotherapy. The treatment is incorrectly billed as physiotherapy. Physiotherapy must include an assessment, diagnosis, and treatment plan. Where the treatment is ongoing, there must be a planned reassessment. Mary-Catherine, could you guide us through the steps that the PT should have taken instead in this scenario?
Thanks, Sameera. In this scenario, good practice includes, as you mentioned, that the physiotherapist finish an assessment, collecting details about the patient's experience, their concerns and goals, objective measures, and a clinical analysis, diagnosis, and detailed treatment plans specific to the patient's conditions. The physiotherapist must explain the benefits, risks, and any alternatives to Pilates and gain the patient's consent to include this type of treatment. Before introducing new exercises or treatments, ensure the patient understands the proposed plan, including any potential risks. Obtain their informed consent to go ahead with Pilates treatment. A physiotherapist should continuously monitor the patient's response to the treatment. Be prepared to adjust a plan based on the patient's progress and any new symptoms that arise, prioritizing their safety and well-being. Any billing done as physiotherapy care must include all of these components.
Thank you, Mary-Catherine. That brings us to the end of our presentation. Please feel free to reach out to us at Practice Advice if you have any questions related to the scenarios presented today. For your convenience, we have included the links to all the resources mentioned today, just posted below the video.
Thank you for joining us.